Hello, welcome to my YouTube channel, and in today's video we are going to look at diabetic ketoacidosis. My name is Venon Yusufa, but before we go further, please don't forget to subscribe to my YouTube channel and also don't forget to like and share my videos. Without wasting your time, let us get started. First of all, we need to ask ourselves, what is ketoacidosis? So ketoacidosis is the abnormal accumulation of ketone bodies normally above 0.6 millimoles per liter in blood plasma. There are three types of ketone bodies, namely acetone, acetoacetate, and beta-hydroxybutyrate. The first two are true ketone bodies with a keto group, while the last are the only ones that produce energy. So acetone and acetoacetate, these are the true ketone bodies because they have got a keto group, while beta-hydroxybutyrate, it is not a true ketone body because it doesn't have a keto group. On the other hand, acetoacetate and beta-hydroxybutyrate, these are the only ketone bodies that are able to produce energy because they can be broken down to acetyl-CoA, which can be used in the TCA cycle to produce ATP. So, since we have known now the definition of diabetic ketoacidosis, or rather ketoacidosis, we need to understand what are the causes of ketoacidosis. So, causes of ketoacidosis, the most common causes of ketoacidosis, we have got diabetes mellitus. So, diabetes mellitus, which means type 1 diabetes mellitus and type 2 diabetes mellitus, can cause ketoacidosis. What else can cause ketoacidosis? Starvation. So, if a person is starving, this person can have ketoacidosis. What else? Infections such as pneumonia and UTIs can cause ketoacidosis. Before we can tackle diabetic ketoacidosis, first of all, we need to understand what is happening here. So here I've got this good guy, and this is an enzyme. This enzyme, it is known as hormone-sensitive triglycerolipase. So this enzyme is one of the most regulated enzymes in the body. So we have got regulators on top. On the left-hand side, we have got insulin and caffeine, while on the right-hand side, we've got glucagon, catecholamines, cortisol, and growth hormones. So insulin and caffeine, what they actually do is that they downregulate the activity of this enzyme. Or in other words, what they do is that they inhibit this enzyme. While glucagon, catecholamines such as epinephrine and norepinephrine, as well as cortisol and growth hormones, they activate this enzyme. But someone would ask, what is the function of this same enzyme? So the function of this enzyme is simply converting or breaking down triglycerol to glycerol and free fat acids. So what is triglycerol? You know that when free fat acids are being produced in the body, they are taken to the adipose tissues where they're kept or stored in form of triglycerol. So in other words, triglycerol is a storage form of fat acids. So in situation where a person is starving or a person has diabetes mellitus, what will happen is that there is lack of insulin. And if there's lack of insulin, what it means is that this enzyme won't be inhibited. And it will start breaking down triglycerol to glycerol and free fat acids. So lack of insulin and the presence of any of these will actually activate this enzyme. And you find that triglycerol will be converted to glycerol and free fat acids. Glycerol can be used in gluconeogenesis, or it can also be used to produce dihydroxyacetone 3-phosphate, which can enter glycolysis. While the free fat acids, they can be used in beta oxidation. What we shouldn't forget also is that insulin is very important. It is the one that activates the enzyme that produces malonyl-CoA. You know the enzyme? The enzyme, it is called acetyl-CoA carboxylase. So that enzyme, it is activated by the presence of insulin. So what does it mean if insulin is not there? So it simply means that if there's no insulin, malonyl-CoA won't be produced. And that means that we cannot produce new fat acids. So this is done to prevent futile reactions. Futile reactions, these are two opposite reactions that occur at the same time. So to prevent two opposite reactions occurring at the same time, one reaction must be inhibited while the other is taking place. So when you are building fat acids, cannot make sense we're building fat acids and we're breaking fat acids, okay? So when you're building fat acids, the breakdown of fatty acids must be inhibited and vice versa. So in this case, let's say a person is starving. Triglycerides was being broken to glycerol and free fatty acids. The free fatty acids enters beta oxidation. So we cannot be breaking down free fat acids at the same time making free fat acids. It means we're wasting energy. So malonyl-CoA cannot be produced in the absence of insulin. And do you know what malonyl-CoA does? Malonyl-CoA, it inhibits carnitine palmitoyl transferase 1. So if there is no malonyl-CoA, it means that there is no inhibitor for this enzyme. And this will facilitate the process of beta oxidation to take place. But what are the results of beta oxidation? The results of beta oxidation, we've got acetyl-CoA. And what is the fate of this acetyl-CoA that is produced in beta oxidation? It has two fates. It can either enter TCA cycle to produce energy, or it can enter ketogenesis. Now, our main interest is ketogenesis, because for us to explain what happens in diabetic ketoacidosis, we need to have knowledge about ketogenesis and all this as well. So actually, this is simply the beginning of things. So just to run you through once more, if there's lack of insulin, this enzyme will be activated. So lack of insulin or lack of caffeine or both of these will activate this enzyme. The presence of this will activate this enzyme. And this enzyme will convert triglycerol to glycerol and free fat acids. Free fat acids will enter beta oxidation to produce acetyl-CoA, which can either enter TCA or ketogenesis. So let's look at ketogenesis. So here I've got ketogenesis. Ketogenesis actually involves few steps. The first step, it involves the combination of two acetyl-CoA to produce acetyl-CoA. And the enzyme that combines two acetyl-CoA to produce acetyl-CoA, it is called thiolase. So when it combines to acetyl-CoA, it removes the coenzyme A to form acetyl-CoA. In the second step, another enzyme which is called HMG-CoA synthase, it adds another acetyl-CoA to acetyl-CoA in order to form beta-hydrox beta-methylglutaryl-CoA, or in short, HMG-CoA. So this enzyme that does this is called HMG-CoA synthase. From there, beta-hydrox beta-methylglutaryl-CoA is converted to acetoacetate by an enzyme called HMG-CoA lyase. So what this enzyme does, it simply removes one acetyl-CoA from the HMG-CoA. Here we've got acetoacetate. It can either be converted to acetone by spontaneous decarboxylation, or it can be converted to beta-hydroxybutyrate by an enzyme called beta-hydroxybutyrate dehydrogenase. So in a nutshell, this is ketogenesis. Now let us talk about ketolysis in extrahepatic tissues. So what is ketolysis? Ketolysis is simply the breakdown of the ketone bodies that are produced in the liver. So ketone bodies or ketogenesis take place in the mitochondria of the liver cells. So once the ketone bodies are produced in the liver, they are taken to other tissues such as the brain and the muscles. The liver itself cannot use ketone bodies because it lacks a certain enzyme which is called thiophorease. So these ketone bodies that are produced in the liver must be taken to other tissues such as the brain and the muscles that have got this enzyme. And when they reach those tissues, the ketone bodies, they are broken down to form acetyl-CoA. And the breakdown of ketone bodies to form acetyl-CoA is what we are calling ketolysis. So let us look at the few steps of ketolysis. So imagine that we are in the brain here, and this beta hydroxybutyrate, it has reached the brain. So beta hydroxybutyrate and other ketone bodies, they are water soluble, so they don't need any lipoprotein or any transporter to be transported in the blood. They can just move on their own in the blood because they are water soluble. You should always remember that. So look at, this is beta hydroxybutyrate. Let us say that it is in the brain. So when it reaches the brain, it can be converted to acetoacetate by an enzyme which is called beta hydroxybutyrate dehydrogenase. This enzyme, it is also found in ketogenesis. So we can say that this process, it is reversible. It is a reversible process. The same enzyme that is found in ketogenesis is the one that is in here in ketolysis. So once we have acetoacetate, we can convert it to acetoacetyl-CoA by an enzyme, this special enzyme, which is only found in extrahepatic tissues. This enzyme, it is called thiophorase. So what does this enzyme do? This enzyme, it obtains the coenzyme A from succinyl-CoA and adds it to acetoacetate to form acetoacetyl-CoA. At the same time, it produces succinate. Then acetoacetyl-CoA can be broken down or can be cleaved into 2-acetyl-CoA by an enzyme which is called thiolase. So it breaks down acetoacetyl and adds a coenzyme here to form 2-acetyl-CoA. Now, what is the fate of these 2-acetyl-CoA? So in the brain or in the muscles, these 2-acetyl-CoA can enter a Krebs cycle to produce ATP. So what you should know is that the muscle cells and the brain, these, they use ketone bodies. And the brain, it is also special because the brain cannot use beta oxidation. So the brain relies solely upon glucose or glycolysis and ketogenesis. The brain cannot use fat acids. The brain can only use glycolysis and ketogenesis to produce energy. So this process, it is very important for the organs like the brain. Okay, how many ATP are produced in ketolysis? So ketolysis generates 20 ATP from 2-acetyl-CoA in tricarboxylic acid cycle. Tricarboxylic acid cycle, we know that when an acetyl-CoA enters TCA cycle, it produces 10 ATP. So here we have got 2 acetyl-CoAs. And with these two, when they enter the TCA cycle, they produce 20 ATP. So we can say that 1 beta hydroxybutyrate produces 20 ATP. Having that knowledge about ketogenesis and ketolysis, let us now get further to diabetic ketoacidosis. So in diabetic ketoacidosis, there is high level due to lack of insulin. So there is high level ketone bodies due to lack of insulin, which regulates the uptake of glucose into the cell through GLUT4 transporters. So insulin is very important because it's the one that enables the expression of GLUT4 transporters in cells like the adipocytes and the myocytes. So without insulin, it means that GLUT4 transporters won't be there and the glucose cannot enter the cells. So lack of glucose in these cells will result in these cells to start using other secondary sources of fuel, such as fat acids. So like I explained earlier, lack of insulin will activate an enzyme called hormone-sensitive lipase. And that enzyme will start breaking down triglycerol to free fat acids. And those free fat acids, they can enter beta oxidation to produce acetyl-CoA, which is used to form ketone bodies. So lack of insulin activates ketogenesis and it causes hyperglycemia and hyperkalemia. So hyperglycemia is caused because glucose cannot be absorbed into the cell. So as you are eating your meal, glucose will start building up outside the cell, and that will lead to hyperglycemia. Hyperglycemia is simply the abnormal buildup of glucose in the blood plasma. What about hyperkalemia? So hyperkalemia also comes about because A person who has got diabetic ketoacidosis or who has diabetes mellitus, these people, they urinate a lot and they lose a lot of water. As they are losing a lot of water, they lose a lot of electrolytes, such as potassium and sodium. So over the time, a person is going to have hypokalemia, low level of potassium in the blood, because this person is urinating or losing a lot of water at the same time losing a lot of electrolytes. So ketone bodies, they are acidic in nature. So what does it mean? It simply means that the pH of acetoacetate is 3.7 and that of beta hydroxybutyrate is 4.7. The normal level of ketone bodies in the blood is less than 0.6 millimoles per liter. So whenever we have got the level of these ketone bodies above 0.6 millimoles per liter, that is ketoacidosis. So high level of these ketone bodies can lead to low blood pH, and this has got many effects. So like I said, we have got three types of ketone bodies. We've got acetone, acetoacetate, and beta hydroxybutyrate. Acetone is volatile and it is expired, giving rise to the fruit-smelling breath. While these other two, beta hydroxybutyrate and acetoacetate, these ketone bodies, they are used in the production of energy. Only acetone is expired. So the increase in the level of these ketone bodies can lead to ketonemia. So what is ketonemia? Ketonemia is simply the accumulation of ketone bodies in the blood. So when the level of ketone bodies in the blood increases, they can be excreted in urine, and that will result in ketonuria. Ketonuria is actually the presence of ketone bodies in the urine. So the combination of ketonemia and ketonuria, it is called ketosis. So ketosis is actually a combination of these two things. We should also note that lack of insulin, it impairs the sodium potassium pump. So the sodium potassium pump, this pump actually depends on the presence of insulin. If there's insulin, it means that it will be able to work normally. But in the absence of insulin, it cannot work properly. And this potassium cannot enter the cell, and sodium at the same time cannot leave the cell. So what happens is that this pump, in the absence of insulin, cannot work. And that will result in the buildup of potassium outside the cell. But over the time, potassium and the sodium will build up outside the cell. And that potassium and sodium can be excreted through the urine together with water. And that can result in low level of potassium. So at the beginning, what we are going to have is hyperkalemia and hypernatremia. But these electrolytes can be excreted through urine. Because, like I said, high level of glucose will lead to loss of water. So when water is being lost, even electrolytes will be lost. As a result, from hyperkalemia, we are going to have hypokalemia. Okay? So this is what happens. Hyperglycemia can cause osmotic diuresis and glycosuria. So what is osmotic diuresis? So osmotic diuresis, this is actually the loss of water. So when water is being lost, because it cannot be reabsorbed, it is being lost due to the presence of glucose in. So we are going to find that we are going to have osmotic diuresis. And glycosuria is simply the presence of glucose in the urine. What else? So we can look at this diagram here. So DKA can cause metabolic acidosis, and this metabolic acidosis can result in Kussmaul's breathing, which can lead to respiratory alkalosis. So we need to break down these terms one by one. What is metabolic acidosis? So metabolic acidosis, it simply means the decrease in the pH of the blood due to metabolic activities such as ketogenesis. So in ketogenesis, when there's a lot of ketone bodies being produced, it can lead to metabolic acidosis. So now, what about Kussmaul's breathing? What is Kussmaul's breathing? So Kussmaul's breathing, it is simply the rapid and labored breath that DKA patients have. And what about respiratory alkalosis? So respiratory alkalosis is simply an increase in the pH due to rapid respiration. So this is a problem. So cosmos breathing can lead to respiratory alkalosis. So let me just try to explain a little bit about the bicarbonate buffering system. So bicarbonate buffer system, it is very important in the body because it's the one that maintains the pH within a normal range. The normal pH of the blood, it is 70.35 to 70.45. So here we have got bicarbonate plus hydrogen forms carbonic acid. And this carbonic acid can be broken down to carbon dioxide and water by an enzyme which is called carbonic anhydrase. This enzyme it is found in red blood cells. And this carbon dioxide can be excreted. So for people who have got metabolic acidosis, it means that their blood is acidic. And what is an acid? An acid is simply a substance that is able to liberate hydrogen ions in aqueous state. So an acid is simply that an acid is a solution that has got a lot of hydrogen ions than hydroxide ions. So when you say that the blood is acidic, it means that there are more hydrogen ions than hydroxide ions in the blood. So the body will try to eliminate or try to convert some of the hydrogen ions into carbonic acid in order to increase the pH. Since this person has got ketoacidosis, it means that the body will try to increase the pH a little bit to the normal range. Okay? And how is it going to do that? So the way it's going to do that is that it's going to convert these hydrogen ions into carbonic acid. And then from carbonic acid, it's going to convert it to water and carbon dioxide. Because like I said, ketoacidosis or acidosis, it means that there is a high level of hydrogen ions as compared to hydroxide ions. So in order to bring the pH in normal range, we need to convert some of the hydrogen ions to carbonic acids. And that will result in increment of the pH to the normal range. Okay, so what is this carbonic anhydrase does that it converts carbonic acid to H2O and carbon dioxide. So this person who has got metabolic acidosis, the body will start producing a lot of carbon dioxide and H2O. You start converting these hydrogen ions to H2O in order to reduce the amount of hydrogen ions and in order to bring the pH to the normal level or normal range. So this carbon dioxide will accumulate in the blood and need to be eliminated or expired or removed. So this person who's going to have cosmos breathing, the person will have a rapid and labored type of breathing in order to remove these carbon dioxide that have built up in the blood. So this is what happens. The person will start breathing rapidly in order to remove this carbon dioxide. But as the person continues breathing rapidly, a lot of carbon dioxide will be removed. And that means that a lot of hydrogen ions will be converted to water and carbon dioxide. And if you've got few hydrogen ions remaining in the blood, that will be another problem. Because it simply means that the amount of hydrogen ions that are remaining in the body will be low, and that is called alkalosis. So alkalosis is simply low level of hydrogen ions or high level of hydroxide ions. So we are converting hydrogen ions to water and carbon dioxide, and that will reduce the amount of hydrogen ions or the concentration of hydrogen ions in the blood, and that will result in respiratory alkalosis, which is another problem. So when managing a patient with DKA, we need to look for certain symptoms and signs. We need to manage these signs and see the best that we can do to help the patient. So the signs and symptoms of DKA is cosmos breathing, fruit smelling breath, hyperglycemia, polydipsia. Polydipsia, this is extreme thirst. So a person has got frequent and extreme thirst. We've got glycosuria, abdominal pain, vomiting, and nausea. So how do we treat a person who has diabetic ketoacidosis? The way to treat a person who has diabetic ketoacidosis is by administering insulin. So insulin will allow the uptake of glucose into the cell, and that will help the cell to stop depending on ketogenesis alone. So the cell will be able to utilize glucose. It will stop dependence on ketogenesis alone. So this is going to help. Administering insulin will be a good thing to help a patient who has got TKA. What else? We need to do fluid replacement because this person is losing a lot of water, and that will help to replace water that is being lost. What else? We can also give the patient electrolytes because we know that in people who have got DKA, they lose a lot of potassium and sodium, so we need to replace these electrolytes. And we should also remember that potassium is very important because potassium helps in the production of insulin. So to give a patient who has got diabetic ketoacidosis or who has got diabetes type 1, you give them potassium, it will help these people to be able to produce insulin because insulin requires potassium to be produced. So this is all about diabetic ketoacidosis in a nutshell.